You know, a lot of people have heard this phrase, socialized medicine. And they say, we don't want government-run health care. We don't want a Canadian-style plan. Nobody's talking about that. We're saying, let's give you a choice. You can choose the private marketplace or this other approach. And I got a letter the other day from a woman. She said, I don't want government-run health care. I don't want socialized medicine. And don't touch my Medicare. and you know, I wanted to say, well, you know, I mean, that's what Medicare is it's a government-run health care plan.
Former Speaker Gingrich refers to the Ryan plan as social engineering. Of course, he refers to the president's health care reform as social engineering, and he's against social engineering. I would argue that Medicare is social engineering. Medicare is, in fact, one of the biggest social engineering projects of the 20th century. And without substantial change, it's social engineering that isn't going to make it through the 21st century. How is it social engineering? If you look at traditional Medicare, it's a fee-for-service program. It's an uncapped entitlement. Well, some people say to services, but I like to think of it as an uncapped entitlement to payment to the health sector.
Once again, socialism. As the only socialist in cable news who actually knows he's a socialist and admits it, because, as I've explained in this space before, and as Newsweek correctly explained in 2009, we are all socialists now. The socialism argument is the single stupidest argument we have in our society because Americans generally do not know what the word socialism means. Bill Maher helped define it on his HBO show on Friday night, and that caught the eye of socialism hater Bill O'Reilly, who is, of course, also, like the rest of us, a socialist.
Now, I've known Bill Maher for years, and recently, as you know, he's taken a drastic turn to the left. We've documented that on The Factor. Here's the latest.
You know, in Europe, socialism is just another political party. And it doesn't mean that we're against making a profit. It just means that government takes over certain things like hospitals and prisons and the military that shouldn't be schools that should not be run for profit.
Well, Maher's absolutely correct, but why? Why would any clear-thinking human being want to give the government more power? That erodes freedom, Bill. Are you hearing me? Don't be a pinhead.
So letting government take over certain things like hospitals, prisons, the military, and schools erodes freedom.
Absolutely, but look how it's going to affect my office. Half of doctors are already not taking Medicaid. So if you end up getting shoved onto the state exchanges, which everybody thinks is going to happen, and you're going to get to keep insurance if the individual mandate stays in, so you'll get some subsidized insurance that I might not be able to take in my office, or Medicaid, which I don't take.
So the just idea because the government has an option for you doesn't mean your doctor is going to participate in that option.
You better believe it. So the idea that you get to keep your doctor has always been not true. Not true. And now we're seeing you're not going to get to keep your plan. You're not going to get to keep your plan, and the new plan you get, I'm probably not going to take. Here's the bottom line. Doctors cannot afford to work with this insurance that are not paying us enough to keep our doors open. That's the direction we're heading.
Well, there's going to be some doctors who are going to take this. So, I mean, he says my new doctor is going to be the emergency room, but there will be some doctors who will take the insurance by the exchange.
There will be some doctors who take it, but we will see that two-tiered system where the very great doctors that you want to go see, you're going to pay an exorbitant amount if you want to, and very wealthy people are going to do that.
Melissa, isn't that already happening? I mean, we live in New York City.
Yeah.
I can tell you already several of my doctors have gone to cash only.
Right.
I mean, the president has said he's been trying to get around the two-tiered system.
Regrettably, most institutions have had to institute a review board, often with an ethics committee, to develop harrowing plans of how to ration chemotherapy drugs, most of which are generic drugs that have been available for 30 years or more. How do you decide who should be given the chance to live? As with any issue, there's multiple reasons for the current drug shortage. However, the timing is notable. In 2003, the Medicare Modernization Act was put into place. In 2004, the FDA reported 58 drug shortages. In 2011, the number skyrocketed to over 200. The intent of the MMA was to create more transparency in pricing. However, generic prices are driven down by market competition, and the current model under the MMA makes it difficult for companies to raise prices more than 6% per year. Product margins have fallen significantly for many generic drugs, leaving companies with no incentive to continue manufacturing the drug or to increase production. The current situation is nothing short of a massive national emergency. The burden is on us to resolve the crisis to protect our children. None of my patients' families ever thought they would be faced with the diagnosis of childhood cancer. Today alone in the U.S., the parents of 36 children will be told, your child has cancer. Let's act to ensure these parents can also be told, we have drug available to cure your child. Thank you.
Medicare, which does not cover most drugs, does pay for cancer drugs, and it is creating a huge problem.
Sooner or later, we're going to find a situation where there just isn't enough money in the till to pay for these drugs for everybody.
Indeed, experts say the new cancer drugs are becoming one of the biggest strains on the entire healthcare system. Robert Bazell, NBC News, New York.
So if I was thinking about Medicare and making sure that I was secure, the thing that I would be most worried about right now is healthcare inflation keeps on going up, and the trust fund in 10 years is suddenly in the red, and now Congress has to make some decisions. Are they going to put more money into Medicare, especially given the deficits and the debt that we already have? Or are they at that point going to start making decisions about cutting benefits, but not based on any science or what's making people healthier? They're just going to start making it based on politics.
And what I've tried to explain to them is, number one, if you look at the numbers, then Medicare in particular will run out of money, and we will not be able to sustain that program, no matter how much taxes go up.
Now, I got a letter the other day from a woman. She said, I don't want government-run health care. I don't want socialized medicine. And don't touch my Medicare. and I wanted to say, well, I mean, that's what Medicare is. It's a government-run health care plan.